See here. What is EDH? Basically, what is EDH and what is SDH?
Epidural hematoma.
Antidiuretic hormone.
Subdural hematoma and epidural hematoma.
EDH.
So, are you talking about hematoma?
Yeah, hematoma. I am
So it's extradural and
neurosurgery.
subdural.
Yeah, neurosurgery. Yeah, extradural hematoma and subdural hematoma. Yes. So we have the brain layers like pia, arachnoid, and dura mater. Okay, these are the three layers anatomy: pia, arachnoid, and dura. If it is outside the dura, it is extradural. If it is below the dura, it is subdural. Can anyone tell me why these occur? Extradural hemorrhage, why is it occurring? And subdural, why is it occurring?
Due to fracture or
Extradural hemorrhage is due to arterial bleed. Which artery?
middle
Middle
artery.
Very good. Subdural hemorrhage is to venous hemorrhage. Which veins? The bridging cortical veins. We call it as a bridging cortical vein. Okay. So obviously artery, extradural hemorrhage is an emergency. Okay. And subdural veins, it's not an emergency. And how to differentiate it? With the help of a CT scan. See, this is the most important. See, extradural hemorrhage will look like this. See this picture A. It is looking like. How is it looking like?
Lemon shape.
Okay. It is looking
Biconvex.
like it is a lens shaped. Okay. And here it is
Crescent.
It's a crescent shaped. Very good. It's a crescent shaped. Okay. They may just give you these images also. So lens shaped hemorrhage is extradural hemorrhage. Subdural is crescent shaped. Lens EDH, it is from arterial source, middle meningeal artery. Whereas STH is from
venous.
Yeah,
Cortical
veins. Yeah.
Bridging
See
cortical.
here, this is not necessary, but just extradural hemorrhage and subdural hemorrhage. Extradural hemorrhage between the skull bone and the dura mater, outside the dura, between the skull bone and the dura. Whereas subdural is between the dura and the arachnoid. So there are pia, arachnoid, dura. Outside, if it is there, it is extradural. If it is below, it is subdural. The rupture of middle meningeal artery, rupture of bridging cortical vein. Clinical presentation is there will be trauma, there will be skull fracture, there will be lucid interval. What is this lucid interval? Lucid interval is nothing but the patient will have a period of unconsciousness followed by consciousness. This interval will be, this type of cycles will be going on. He will be unconscious for a moment. Again, he will be gaining consciousness. This period is known as lucid interval. And on CT, there will be a lens-shaped hemorrhage or a convex-shaped hemorrhage. Whereas in subdural hemorrhage, there will be a crescent-shaped or a concave crescent-shaped hemorrhage. You remember these images, lens and crescent. Okay?
Okay, sir.
Lens, 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 EDH, 3 and 3. I remember like this. Crescent is subdural, S and C. Okay? So just for remembering. And this is a diagram which will show the base of the skull fracture. What will happen if the base of the skull is fractured?
Nice.
See, this is the skull. This is the base of the skull. Anterior, middle, and posterior. Anterior, middle, and posterior. If the base of the skull is injured, there will be leakage of CSF below. Okay. So if anterior cranial fossa, anterior base of the skull is injured, so the patient will have CSF rhinorrhea. What is CSF rhinorrhea?
CSF leaking into the nose.
Yeah, CSF leaking into the nose. So how to tell whether it is blood or it is CSF? The patient will come to you. How to tell whether it is blood or CSF?
Halo sign.
Halo sign. Very good. What is this halo sign?
Actually, that blood is covered by CSF blood.
Yeah.
CSF.
There will be like this clearing. The halo sign means it will be center is CSF, periphery will be the blood. It will be clearing. Whereas blood will be staining. Okay, that is halo sign. And this halo sign is not a accurate sign. So you just send it for beta transferrin. You just send it for beta transferrin. This is the pathological. This is the investigation of choice. You send the fluid for beta transferrin and you will know whether it is CSF or it is blood. Okay. And then in the middle cranial fossa, if it is injured, you will get CSF otorrhea. What is the CSF otorrhea?
CSF through the ears.
Yeah, CSF through the ears. Okay. The same like CSF otorrhea, CSF rhinorrhea. And you have two important signs here. One is the battle sign. What is this battle sign?
Ecchymosis in the
Yeah, ecchymosis over posterior auricular region.
Behind
Ecchymosis in the
the
posterior auricular region is known as
ears.
battle sign. You can see here D. You can see here D. This is a sign of, what is this sign of? If there is ecchymosis in this region, what does this indicate? If battle sign is there, what does it indicate?
Middle cranial fossa fracture.
Yeah, middle cranial fossa fracture, base of middle cranial fossa fracture. And the last is raccoon eyes. See here, raccoon. The eyes will look like a raccoon. This is a raccoon. Raccoon eyes or panda eyes. Okay. So raccoon eyes or panda eyes are seen in which fracture?
base of
skull
skull.
fracture.
Yeah, base of skull. Which base of skull? Anterior, middle, posterior?
Middle.
Will it be anterior?
It will be anterior.
Anterior.
See, anterior, there will be rhinoria, there will be raccoon eyes or panda eyes. Middle, there will be CSF otoria, and there will be battle sign. Okay. Yes?
Yes, sir.
Okay.